A pleasant day to all. My name is Adrian, Phillip Villagracia, and together with me are my members, Adeline Mae Villando, Audrey Sophia Villanueva, and Evan Villanueva. Together, we are BN3A's Group 4B, and we will be presenting our research paper entitled Breaking Down Barriers, an in-depth exploration of community residents' utilization of healthcare services. This study aimed to explore the utilization of healthcare services among community residents.
For the research design, this study is a qualitative research grounded in a phenomenological approach, providing an in-depth exploration of community residents' utilization of healthcare services. As for the participants, this study involves selecting 8 participants through propulsive sampling, adhering to specific inclusion criteria, at least 3 years of residency, age 18 or above, registered voter of the locality, and recent utilization experience of health services. For the instrument, the researchers utilized a validated researcher made interview guide consisting of 3 sections. First, participant's profile, then a central question, and follow up questions.
Moving on to the study's result, the researchers have formulated 6 themes with sub-themes for each, encapsulating the community residents' utilization of healthcare services. The first theme is their healthcare utilization. The sub-themes under this theme are 1A, types of healthcare services availed, and 1B, frequency of healthcare service utilization. Sub-theme 1A, types of healthcare services availed, revealed that many of the residents availed the services like consultations, check-up, and they go to the healthcare center to ask for help and medicines. As for the women, they also availed the prenatal checkup. Subtheme 1B, frequency of healthcare service utilization. Residents visit the health center with varying frequencies, such as immediately for acute issues, 2 to 3 times a month for family illnesses, 4 to 5 times a month for family checkups, and twice a month for routine checkups or urgent concerns. For the second theme, the factors influencing healthcare decisions focuses on the various challenges and preferences shaping the residents' healthcare choices. Subtheme 2A, which is the accessibility of healthcare center, focuses on the challenges including distance, rocky roads, and transportation difficulties, especially during emergencies or adverse weather conditions, which limits access to needed services. Subtheme 2B, health literacy, focuses on the residents' challenges, including difficulty understanding medical explanations, a preference for herbal remedies, uncertainty in administering medication, and seeking health care only when unwell. Subtheme 2C, severity of disease, focuses on varying attitudes toward medical care, influenced by age, beliefs, and perceived health severity. Some self-assess and seek help only for severe symptoms, while others prioritize regular checkups due to serious conditions. Subtheme 2D, family support, highlights the crucial role of familial support in healthcare access and management. Many residents rely on family members for assistance during checkups and treatment, with spouses and siblings providing consistent help during times of need. For the third theme, feelings towards healthcare services include subthemes 3A, satisfaction, in which residents express positive sentiments due to prompt emergency actions, confidence in care, accessible free checkups, medication, and competent familiar staff. And subtheme 3B, dissatisfaction, in which residents report dissatisfaction due to unfamiliar healthcare processes, concerns about care quality, inadequate service, unclear communication, and insufficient diagnostics.
Moving on to our fourth theme, which is challenges accessing healthcare services, our sub-themes are geographical, knowledge about health, and limited services of health center. The significant statements in the first sub-theme reveal that the participants are having a hard time utilizing healthcare services due to lack of transportation and distance. It may also be affected by natural calamities which hinders them to visit the healthcare centers. In the second sub-theme, significant statements disclosed a lack of knowledge about health and the importance of maintaining it, thus hinders the participant to visit healthcare facilities as they deemed it unnecessary and there was no foundation of health teaching based on their past experiences. And lastly, in our third sub-theme, there are few services that are provided for free. Thus, the participants often hesitates to have a consultation or opt to go to private hospitals or private laboratory to seek help.
For the fifth theme, this emphasized the management of challenges. The participants discussed about financial assistance and utilized mobile phones or telemedicine services, illustrating their strategies for coping with healthcare service barriers.
Lastly, for theme 6, focusing on suggestions for healthcare improvement, with sub-themes additional services and improved accessibility, participants in the study voiced consistent desires for improved healthcare services, emphasizing the need for targeted interventions and address delivery and accessibility gaps. Suggestions included expanding diagnostic capabilities, increasing manpower, and ensuring consistent stock of essential supplies. Participants also advocated for initiatives such as mobile healthcare units and expanded barangay health worker programs. So, in conclusion, findings from the first theme reveal consistent healthcare service utilization patterns among residents, prioritizing prenatal checkups and medication consultations. Emphasis on preventative care prompts seeking of care when needed, although visit frequencies varies by illness severity. These insights emphasize the importance of tailored healthcare delivery in rural areas, echoing previous research on significance of preventative care. In Theme 2, the study identified key influences on participants' health decision, notably accessibility hindered by distance and road conditions, impacting healthcare utilization. Limited health literacy raises concerns about medication adherence, while illness severity determines seeking medical help, emphasizing the significance of support networks in decision making, consistent with prior research on social support. The interview findings from the third theme on healthcare services reveal a mixed bag of satisfaction and dissatisfaction. Participants appreciate staff professionalism and free service of accessibility, but voice concerns about unfamiliar processes, care quality, and inadequate provision. These findings stress the need for healthcare service providers to address these issues and improve overall healthcare experience for residents, aligning with existing literature. The fourth theme underscores formidable obstacles to healthcare access in the community, notably transportation limitations and distance to healthcare facilities. Participants relied on barangay health workers during adverse weather when transportation was scarce. Furthermore, inadequate health literacy and limited services in the local health centers underscores the necessity for comprehensive healthcare services and strategic resource allocation to bridge access gaps. The fifth theme highlights financial barriers hindering healthcare access, particularly for low income individuals who struggle to afford medical expenses, leading to delayed or neglected care. Addressing these challenges requires affordable healthcare options and improved medication accessibility. Telemedicine emerges as a promising solution, offering convenient remote consultations, especially beneficial in remote areas, with studies indicating its potential to enhance healthcare utilization metrics and provide valuable insights to its benefits. Lastly, in Theme 6, participants stressed the need for healthcare improvements, targeting delivery and accessibility issues. Proposed solutions include expanding diagnostic capabilities, increasing staffing, and tackling supply shortages. Effective interventions like mobile healthcare units and barangay health worker programs must be implemented to ensure equitable access to healthcare in rural areas. For our recommendations, the study on healthcare access in a local community underscores collaborative efforts between the local government unit officials and community stakeholders to address barriers effectively, emphasizing resource allocation for infrastructures, transportation, and culturally sensitive healthcare programs. Empowering patients and families through health literacy programs and advocacy can enhance healthcare decision making. Healthcare facilities should expand services, embrace telemedicine, and engage with community partners to bridge access gaps. Clinical instructors and universities should integrate real world challenges into education, fostering empathy and cultural competency among future healthcare professionals. For the future researchers, they are encouraged to build upon these findings to further explore healthcare access factors and contribute to addressing disparities. Here is the QR code for our references, and that is the end of our discussion. We thank you so much for listening and hope you have the great rest of your day.